I know we've got a lot to talk about today, but what can you tell our viewers about yourself and why you're on Clean Talk today?
Well, I'm very fortunate to be able to share some of my story and tips and how we've gotten through this pandemic and other issues throughout my career. But I've had a very colorful career. I didn't start as an infection preventionist. I started as really a marine biologist back in college. And so I've had a very interesting career track that I think a lot of people can look at and take some advice from, or even just take interest in, and realize that you don't always start in a certain place where you think you're going to finish. So.
Well, that's right. And we'll dive into that a little bit. But looking at your bio, Chad, I think we might be brothers from another mother. We have a lot in common. We're both Florida natives. We both went to school in Orlando. We both live in Jacksonville with our families, and both very passionate about infection prevention and infection control. So really appreciate you being on the show today. And really curious to find out, you talked about how you kind of had a change of career paths to get into epidemiology and infection control. And this sounds a little strange, but I have a note here that it has something to do with turtles. Can you tell us about that?
Yeah. So back at UCF, where I was doing my undergrad, I was a biology major and then got involved in the UCF Marine Turtle Research Program. So I thought marine biology was going to be a great path for me. And so indeed, I started doing sea turtle research out in the beautiful Brevard County region of the state. But what we ended up seeing while we're measuring and doing workups on turtles was these turtles started washing ashore with different types of viral tumors. And so when I asked the grad students who were sort of supervising, hey, what is this? They said, well, you should take an epidemiology class. You'll see how diseases move throughout populations. Well, I did that and then really fell in love with epidemiology. And so that led me very naturally into infectious disease control and prevention. And it all really happened because of some sea turtles washing up in Melbourne Beach, Florida.
We're really excited to have you here. You know that we are an infection control podcast. We love everything infection control, and we're so excited to have such an esteemed guest. What can you tell us about your background and why you're on Clean Talk today?
Excellent. Well, I love infection control too, hence the reason I'm here and have that title. I've been in infection prevention for the last 17 years. Started really as a bit of an accident, actually. I was working as in a temp role for an infection prevention department while I was waiting to start dental hygiene school. And after just a few days of being in that role, really fell in love with infection prevention and ultimately sort of changed my career trajectory. So over the next few years, finished my bachelor's degree in public health, my master's degree in public health, and last year during the height of the pandemic, finished my doctorate in public health, which the timing wasn't great, but I'm certainly glad it's over. So, and I've worked for a number of large healthcare organizations over that 17-year period, and am a CIC certified and an APIC fellow.
Well, I think the timing was perfect because we need you more than ever right now in this role. I think it's fascinating that you started on the dental side of things. Certainly infection prevention, extremely important in dental. And you not only saw that, but you decided to make that your calling. Chaz, what more can you tell our audience about yourself, your background, and why you're on Clean Talk today?
Absolutely. So as you mentioned, I am an Assistant Vice President of Infection Prevention for HCA Healthcare, and I've been here for about 3 years. Just so you know, my educational background, I am not a nurse by trade. I actually have a master's in public health with a concentration in epidemiology from the University of Florida. So go Gators.
Go Gators.
And I've been in infection prevention for about 15 years now. And so every time I say that out loud, I take a moment to pause and think, wow, that's gone by fast. So that's just a little bit about my background.
Well, we've been doing this a little over 15 years as well, trying to fight the good fight along with you. What more can you tell our audience about HCA North Florida and your mission there?
Sure. So our division is composed of 15 healthcare facilities throughout the panhandle of the state, Gainesville, Ocala. and also Orlando. And we're in the business of healing patients and taking care of them and treating them like family. So certainly infection prevention is a big part of that. We want to keep patients safe while they're moving through our healthcare system. So that's what my passion is, and that's what my team does.
And can you tell us a little bit more about your role? I know you have a leadership role in infection prevention. Maybe you can give our audience some specifics on what your day-to-day is and your focus.
Sure. So my role is more of a consultant or a coach to our on-site IP directors and teams. So anything that they need, I tell them to reach out to me. So if it's tough conversations that need to be had with their internal leadership, helping them implement certain projects, just anything, any barriers that they need advice on removing, any coaching in terms of leadership development or career development, anything that I can provide for them. That's at my fingertips. I like to get it to them. If they ask me questions I don't know the answer, I can go out and find it as they're, boots on the ground and busy in the trenches doing the work. I can kind of run out and grab things here and there. And that was especially important during the pandemic because, as you know, information coming at us like crazy. So just to be that person here to answer any questions that they have. Also, a major part of my role is to kind of align all of our facilities around a common goal of reducing HAIs and the processes that we use to do that. And I also serve as a liaison between our corporate IP team and, getting that information and implementing our processes within our facilities.
Well, it's great to have you on the show. Kathy, maybe you could tell our guests a little bit about your background and why you're on Clean Talk today.
Sure. Well, I came into the infection prevention arena in 2003 when I was hired to become Chief Executive Officer of APIC, as you mentioned. And it was a really exciting time. My timing was really good because it was on the heels of the first SARS outbreak in 2002, 2003, which really woke us up around infectious diseases. And then MRSA became an issue. And then it was the whole alphabet soup of multi-drug resistant organisms. And we were finding that many healthcare associated infections were actually preventable. So that gave us a platform to really elevate the profession and protect patients. And so that was a very exciting time. Then I spent 5 years, I was recruited by Becton Dickinson and spent 5 years as Worldwide Vice President of Infection Prevention, which enabled me to do more of what I was doing on a global basis. And then I realized that where I had the most energy was around novel technologies. Those things that are not 510K products, that are coming onto the market, have FDA approval, have some evidence that could really make a big difference in terms of preventing healthcare associated infections and protecting patients. But it's very hard for those technologies to gain a foothold in the marketplace. And so much of my work in Infection Prevention Partners is helping those companies develop adequate evidence, help them educate around the problem and the technology, and find ways to accelerate adoption of those handful of novel things that could potentially make a huge difference. I also do some R&D work with these companies, and I've also continued to work internationally to try to advance infection prevention practice, mostly in developing countries.
Priya, can you tell us a little bit about your background and why you're on Clean Talk today?
Yeah, absolutely. So my name again is Priya Pandya-Orozco, and I'm a nurse manager for infection control here at one of the 3 hospitals at O'Connor, which is O'Connor Hospital in the Santa Clara County Health System. But I've been a nurse for about 25 years, and I think what brought me in is I've always had a passion for nursing and for communicable diseases. I started back in the day as a public labor delivery nurse, and then moved into the public health arena, and quickly moved into a immunization director role for one of the nearing counties. And then after that, I really started to see, like, again, as we see all over, how prevention can really be, how we can prevent diseases from spreading. And being in a communicable disease setting sector of public health, it was kind of an easy win to kind of go, if I wanted to go into acute care, where would I go? And it was easy to think of infection prevention. So that's where I landed and where I've loved being ever since for the last 12 years.
Well, we like to think that we're very passionate about infection prevention here at Clean Talk, but I've got to say, you're one of the most passionate infection preventionists I've had the pleasure to talk to. And I can't wait to share with our audience some of the things you've done culturally to have success in infection prevention and healthcare. Madelaine, welcome to Clean Talk. Can you tell us why you're on the show today?
Hi, I am Madelaine Cuevas. I'm here for the show because I'm very passionate about infection prevention. I am an ICU nurse, still practicing, but I became an infection preventionist because as an ICU nurse, you're in the front line. And when I became an infection preventionist, I realized that what we are missing, how can we improve our patients' health? Can we improve our hospital-acquired infection? So I'm really here to let all of you know why we're here, what infection preventionists do, and how we can help you.
Right. And it really does come down to following the best practice processes. What is the approach that you take to reduce those infections?
Yeah, so new approaches, I would say, is about 10 to 15%, but there's nothing better than the basics. There's nothing better than hand hygiene, proper Foley care, proper central line care. And I think those will always remain the basics for prevention efforts. And one thing that we like to do is we're constantly looking at the literature, looking for updated literature to see if there's anything that we can do to further prevent those infections. So for example, one thing that I focused on recently was bringing a new external catheter to Moffitt, and that was done through the CAUTI committee. Through external catheters, we're reducing our risk for CAUTIs because CAUTIs can only be attributed to those indwelling Foleys. So external catheters were beneficial for reducing our CAUTI rates as well. So I helped bring in a new female external catheter recently.
But vaccines, washing your hands and taking care of yourself by not showing up to work sick, not sending your kid to school sick. Those bread and butter ideas of epidemiology over time are exactly what is our ticket to get out of this pandemic, and it's been working so far.
Old school common sense, right?
That's
Go
right.
back to basics. What else can we do different? So you mentioned that there's new technologies that you're implementing into the healthcare system. You talked about metal ions for water purification. We talked about UVC disinfection and driving, hand washing, hygiene, more PPE. What are we missing? Is there something else we should be looking at?
Well, I certainly think the common factor behind all this is people, right? We need people to do a lot of these things. And so, there's a whole field of human factor engineering, which we use a lot when we talk about performance improvement and Lean Six Sigma. We need people to do these things. And so how do we work our infection prevention interventions into a workflow of a nurse or a tech working with patients to allow them to do what we need them to do to protect themselves and the patient? I think that's really the thing that infection prevention has probably been missing for a long time, is that common sense of, yes, we know that a nurse needs to wear PPE and wash his or her hands and do all this. How do we make it really easy for them so that they can't miss it and it's not an impediment to their workflow? We all know there's a healthcare staffing crisis right now in our country. There's not enough nurses, particularly here in Florida with an aging population. So asking them to do more is a problem. It's going to interrupt their workflow and make it harder to do their jobs. And so how do we as infection preventionists make their jobs easier and still allow them to do the right thing? I think that's the big coming flood of infection prevention methods in education.
We've seen that evolution, and it's great to see that we are educating the next generation of infection preventionists, and I'm fascinated at what you guys are doing to do that. So please continue.
Yeah, and no disrespect to my colleagues that were the pioneers in infection prevention back in the 70s, but I think it's very true that often folks transitioned into a role, nurses transitioned into an infection prevention role as they were sort of coming near the end of their careers, and it's definitely more of a 9-to-5 job, and certainly you're not lifting patients and that sort of thing. But over time, that has definitely changed, and the role has become so robust and so interesting and so dynamic that lots of people are interested and really becoming infection preventionists at the very start of their career. APIC has recognized this and done a lot of work over the last decade on developmental pathways for
I'm
becoming.
Sorry. APIC, the Association for Practitioners in Infection Control, right? For our audience members that aren't familiar with that acronym,
yes.
right?
Professionals in Infection Control, that's right. So that's our professional organization. And so a lot of work's been done through APIC to define what an infection preventionist is and sort of the competencies that someone needs to have in order to be successful in their career. And now through the Academic Pathway Committee, we are taking the next step of actually translating that into academic programs. And so that group, Chaz Rhone is my co-lead in that group, co-chair. And then we have represented infection prevention leaders and infection preventionists from across the US, lots of different settings, pediatrics, ambulatory long-term care, et cetera. Folks new in their career and folks nearing the end of their careers as well. And our group's been working for the better part of a year in developing sort of a 3-tiered approach to an academic entry into infection prevention.
Well, it sounds like what we call servant leadership, Chaz. Maybe you can tell us a little bit more about your philosophies on leadership. This is a subject I find fascinating, specifically in healthcare, where so many healthcare practitioners have spent so much time educating themselves on epidemiology, on internal medicine, what have you. They go to med school, they go to residency, but where's the leadership learning? How do you approach leadership in infection prevention at HCA North Florida?
Absolutely. So leadership is actually part of the APIC competency model for IPs, but I think it's a piece that we often, not that we forget about it, but it tends to be the last area that we focus on. So when you come in as an IP, we're very operations focused. So how do we do surveillance? How do we use the systems that are in place? Basically the meat and potatoes of how do we reduce infections. However, leadership is a big part of being successful as an IP. So, I always like to say we are more than technical experts. So we certainly know our material and we're always learning that every day. But I always tell IPs, you can know every guideline and every resource and every method to reduce HAIs. But if you don't have the leadership skills to back that up, your program will not be as successful as it could be. So, communication is very important. Many times we're placed in a position of responsibility, but we don't necessarily have authority. So we can't rely on authority always to get done what we need to get done. There's a lot of collaboration and influencing behaviors. So those are certainly leadership skills that are necessary in infection prevention. So anytime you'll hear me doing a talk at any conference or anything like that, I'm usually not talking about the technical skills. There's lots of presentations around that. My goal and my passion as an IP is to bring to light the things that we need to work on to be the best leaders we can be, not only for ourselves and our teams, but for the patients that are counting on us to help protect them while they're in the healthcare industry.
Well, as you mentioned, infection prevention, very near and dear to our heart here. And we share your mission, which is why we have this podcast, because we can do a better job. But many of these cross-contamination infections are preventable, particularly in a healthcare setting. You mentioned emerging technologies. We love talking about that. Can you talk a little bit about that in terms of the challenges you see? You sort of alluded to it with the regulatory process, 510K, how we get innovative solutions to market. Can you talk a little bit about your experience in that regard?
Sure. I think one of the biggest challenges is, you need a certain amount of evidence for FDA to deem your product to be safe and effective. But the evidence that you need for that hurdle is very different than the level of evidence that the infectious disease and infection prevention communities require in order to adopt something, to put it through the value analysis process and to gain approval on an institutional level. And so that can be a real challenge for smaller companies because through the years, CDC through its guidance and other activities has really led us to believe that unless you have a large randomized controlled trial, we shouldn't be looking at a new technology. But I've seen a number of things come forward where companies just aren't funded to that level. And the amount of investment going into infection prevention companies on the part of private equity and that type of thing is not large. And so I think we need to find a different way, a multitude of smaller studies that produce similar results, other ways of evaluating these technologies. Otherwise, we are going to just forego the potential of things that could really make a difference. And that's a process of education. It's a process of partners who are willing to do studies with you and get that evidence published, and have organizations who publish be willing to accept things that are not gold standard randomized control trials, because until it's published, it doesn't exist.
Priya, let's continue along the lines of gamification. I know that you've done some gamification outside of the film you talked about, incorporating that into your hand hygiene processes and procedures within the facility. What can you tell us about that?
So we wanted to make a phrase that saves. So that's what I've always kind of made fun little quips about the contest names. A phrase that saves mean that in the moment I could help you see something that you maybe didn't see, which is like perform hand hygiene. So at other hospitals where we've done this process, I'll make an example. Like one had a double meaning. It was called, I'm going to tell you, pause. So pause means pause in the moment, or it could mean puppy paws, but it stood for PAWS is how you spelled it. And it stood for please always wash and or sanitize. So if I saw Brad in the hallway, I could easily say, I don't know Brad's name, but I'm going to tell Brad, please pause for a moment. And he'd go, oh, okay, I got to do hand hygiene, because we have signage around everywhere telling what we do. We shared it in new employee orientation. It's part of our culture of safety. So it's something that everybody understood what this was. So we did the same thing here at O'Connor Hospital here. And so what we shared was we had a contest, and they came up with Clean 20. The frontline staff said, I think if you said Clean 20, or somebody even said hashtag Clean 20, that I would know. That means I have to clean my hands for 20 seconds, and it'd be easy, and we could put it on posters forward facing. So we even have posters forward facing to our patients to remind providers and staff, please remember that our phrase that saves is Clean 20. Please say Clean 20, and we'll remember to do our hand hygiene. And they could remind us, and it's forward facing on every patient board, so they can see it from where they're sitting. It's also at the very front of every unit in the hospital, to share the compliance rate for that unit, as well as the statement of what Clean 20 means.
What can you tell us about Santa Clara Valley Medical Center?
Oh, Santa Clara Valley Medical Center is a very nice hospital. People are good. It's one of the 3 hospitals in the Santa Clara Valley Medical Hospital. We have O'Connor, St. Louis, VMC, which is the biggest of the 3, but we have a huge infection preventionist team. All of them, we have a good collaborating team. So it's a 700 bed capacity more hospital with satellite clinics. That's it.
What can you tell us about the importance of sterile processing from an infection preventionist point of view?
So one thing that I look at is the equipment from sterile processing from SPD to the OR back to SPD, just because all of those instruments and scopes are exposed to blood and other organic matter that can cause infection. So it's very important to just see their workflow and see how they travel throughout the hospital. One thing I do is review the practice policies and procedures in SPD. I also regularly round every week in SPD to look at instrument quality, to look at the packaging of instruments as well, is the integrity there, looking for load stickers, chemical indicators. So there's a lot of work to do in sterile processing, even sometimes washing the technicians in there too, when they're cleaning and reprocessing the scopes. That's also a very important process for infection preventionists to be involved with.
Absolutely. I mean, you're seeing it again right now. Shanghai is in a total lockdown as we speak, and that's having supply chain bottlenecks coming down the pipeline. So, it's just the new world we live in right now with different policies and different governments. And so we have to be flexible, and we have to ensure that we don't get sort of caught out in the wind again, like we did when the pandemic started.
Absolutely. Well, Chad, in closing, any last thoughts for our audience? Any special words of wisdom around infection prevention?
Yeah, I think the one thing I will say is I've learned a lot over this pandemic. Probably two things that I think are really important for these IPs out there to hear. Number one, take care of yourself. I think during this pandemic, healthcare staff in general really have been leaned on a lot. And so, we can't be effective at our jobs if we're not taking care of ourselves and our families. I think that's very important. That self-care, right? Put the mask on yourself before you help your fellow passenger. And then second, borrowing from my accreditation standpoint, if you're not involved with your accreditation program as infection preventionists, you should be. Joint Commission and the rest of the accrediting organizations really rely on infection prevention as a cornerstone of their surveys. And so by marrying up the accreditation and infection prevention departments, or at least the staff, you're going to save yourself a lot of trouble and a lot of heartache after Joint Commission if you get it in place before they show up. So.
That's great advice, and that's the last word. Our guest today has been Chad Neilsen. Chad, thank you so much for being on Clean Talk today. Be sure to join us next week at 3 p.m. Eastern Time on Wednesday for another episode of Clean Talk, or go to cleantalk.tv and register and catch up on our episodes. Chad, thank you so much for being on the show today. Until next time, remember, keep it clean. You had mentioned before, Becca, monkeypox. We're all now starting to hear about monkeypox. What can you tell us about monkeypox?
Well, it's exciting. It's keeping things in our field new, and there's always something new to do every day as an infection preventionist. I think there's also Lamphier virus and polio out there this week as well, but monkeypox it's having its heyday across the globe right now. I think this morning I saw 9,500 cases in the U.S. so far. We're definitely sort of hopefully nearing the top of that epidemic curve. But it's where it's a cause for concern because it is absolutely a risk. The morbidity is low, the mortality is low, and it's not a cause for panic. Certainly, I don't think we're going to find ourselves in a resource-stretched place with monkeypox like we were with COVID. Most patients presenting with monkeypox come in through the ED or an urgent care setting and are discharged from there, don't require hospitalization, and most folks go on to make a full recovery. And so where it's concerning, it's novel, and it's taking up a lot of our time making sure everybody knows the processes so we can prevent exposure. It's hopefully something that will be in the rearview mirror much sooner than COVID will be.
You mentioned APIC, the Association for Practitioners in Infection Control. Tell us a little bit more about that and your involvement with that organization.
Yeah, so APIC is our national professional organization, and I'm a member, but I'm also involved with a couple of committees that they have going on. It's some very exciting work to basically increase the number of candidates coming into the field of IP, so making this field, making people aware of it, number one, and making it accessible. And then also, how do we develop and retain the IPs that we have? So one of the committees I'm on is the Professional Development Committee, and we're talking a lot about retaining IPs and the importance of showing progress throughout your career. So we are working on a career ladder model. So instead of you just being an IP or a manager or a director or a system director, there's also an IP 1, 2, and 3 that kind of shows your progress before you have those official, if you want to say, leadership titles. And then the other thing we're working on in the Professional Development Committee is a job description for IPs. If you've spent any time looking for a job in infection prevention or read any job descriptions, they're kind of all over the place. And then also our HR partners sometimes aren't always aware of everything that we do and everything that we touch, nor who can be an infection preventionist. And sometimes they're the gatekeepers between me seeing an application and me not seeing one. So it's very important that we have a job description out there, so people are familiar with who we are and what we do, and the backgrounds we come from. And then the other committee that I'm a co-chair of, and you probably heard about in a previous episode from my co-chair, Becca Bartles, is the Academic Pathway Committee. And so what we're working on in that committee is developing curriculum for a graduate certificate in infection prevention, as well as a master's degree in infection prevention. And so, my story is similar to many other IPs. We discovered IP, didn't really know about it until we knew about it and got the job. But we're working to fix that with APIC. So how can we have an entry path from education all the way to getting employment, and then developing the IP past when they start employment all the way through a subject matter expert, if you will. So that's kind of the goal.
And Kathy, we do have a question from our audience. Has COVID helped awareness of HAIs in general? And does it help to acknowledge how prevalent they are, or has it distracted healthcare from combating HAIs? And I know we have a whole talk track around what's happened with HAIs during COVID. How do you respond to that?
I think it's distracted us from HAIs, and the rise in prevalence during the pandemic, I think, is the best evidence of that. As far as COVID-19 being a stimulus, if you will, for greater investment, I hope that the messages we've been sending ever since I've been involved in this space and before then, investment in public health, investment in laboratory capacity and capabilities at every level, from the individual institution up through population health, investment in infection prevention resources, staffing, education, that sort of thing. Those messages have largely gone ignored, if you will, at a governmental level. Individual institutions have invested more in infection prevention, and that is when they recognized that HAIs not only were, detrimental to their patients, but detrimental to their bottom lines. They started investing in infection prevention. But that investment at the public health level has been systematically defunded at the federal level because of other priorities. Look at what we invest in military as opposed to public health. And that was one of the reasons I think we did as dismally as we did during the pandemic. We didn't have the resources. We didn't have the feet on the street. We didn't have the diagnostic capabilities. And so I would like to think that investment on the federal level, as a nation, that we will reprioritize public health, and that we will recoup some of that investment and be able to make these changes that we've been talking about for decades now, that will make us more resilient in the wake of whatever the next threat is, whether it's antimicrobial resistance or the next pandemic, or whatever the case may be.
I know you talk about speak up safety culture and the benefits. This is kind of what we're talking about here, right? I mean, what more can you tell us about culture, or maybe some of the other fun activities you've done to enforce hand hygiene compliance and infection prevention procedures?
So we're really pushing forward like culture of safety at our hospital, and that goes so well in aligning with infection prevention, because it is about safety, but it's safety for the staff, safety for the patients, safety for visitors, safety for our providers. So what we do is we're doing some education on team steps, which is from the Agency for Healthcare Research and Quality. And I think what was really powerful about the team steps education is there's a fundamental practice, that module that's about communication. And so we've really taken our time to talk about like, how do we communicate? And again, Clean 20 is one way we can communicate. That's just one moment in time of what I should be saying about hand hygiene. But there's so many other instances that can occur, that a great catch could happen if I just have that transparency and I have a culture that welcomes to speak up. So some of the games that we play are in team steps is you can make a paper chain. So it's a game where you could basically, you put paper tape and scissors on sections with groups, and you tell them, remember, you may want to go back in your mind, maybe you made paper chains when you were in kindergarten, and we show them an example of what that is. We don't tell them how to do it. We just say, here's a paper chain. Now we want you to go ahead and make the longest paper chain. You have 2 minutes. And it starts now. And then what you get to do is watch how they collaborate and really see, like, who's that person in the role that takes the lead, right? In that group of 4 or maybe 5, who takes the lead? Who says, you're going to cut the paper, you're going to take the tape? Do they even do that? Maybe they don't do that. Maybe there's not speak up in that group. Maybe they're more introverted. But how do we get to that goal, right? The goal was to make the longest chain, but what really happened in that exercise is team building, right? And that reliance on and doing it together to win something, to get something. We're going to make the biggest paper chain, right? And they're having fun. They're having fun doing it. And that creates like the camaraderie that you really need to have there to really enhance the culture of safety, right? So we want to create a safe and a welcoming environment for people to learn and play, right? And also grow and be educated.
What more can you tell us about the UV solutions that you're using? Is it a UV robot? What are you doing with UV light?
So it's a UV Trudy. What we're using is
Trudy.
Trudy,
Okay.
yes. What we're using. The good thing about Trudy is, as an infection preventionist, I can monitor what rooms are being like UV lighted because we have access. So basically, you have, as long as they ensure that everything is downloaded on time. As an infection preventionist, we can monitor the rooms that are UV lighted and ensure that those rooms that needs to be UV lighted are UV lighted. I like the technology. It has a lot of articles that says that UV light really can improve C. diff and also other healthcare associated infections.
What can you tell us about your contributions at Infection Control today? And should we expect to see more work from you literarily?
Yeah. So definitely expect to see more work. I started working with Infection Control today, summer 2022, and I'm a freelance author for them. I also have recently joined their editorial board as well. So I try to contribute a few articles a month to them. Some of them that I've done have been on food hygiene, as well as sharp safety. And I also had a cover on day in the life of an infection preventionist and what a typical day looks like. And I love working with them and providing that education to other infection preventionists or other individuals that are interested in infection prevention in healthcare. And in the future, we also have some videos that we will be doing with Infection Control today, which I'm really excited about, just so we can have some content on their website that's video-based, which is also helpful for learning as well.